and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am joined by Lisa Doan, the health promoter, and Bailey Tate, the service navigator and outreach worker, both at Grand River Community Health Centre. This is a CHC in Brantford, Ontario. Through the Systems Navigation Access and Partnership, or SNAP project, CHCs are increasing efforts to improve health and social systems navigation access to strengthen Canada's healthcare landscape and eliminate health disparities while improving population health outcomes. And Grand River was one of our fund recipients. How are you both doing today?
I'm doing well. Thanks,
Good.
Hilary.
Good.
I'm also doing okay.
Oh, you're both good. Good. Perfect. So Lisa, I will start with you. If you could tell us a little bit more about Grand River Community Health Centre, the community that you serve, and some of the programs that you offer.
Yeah, of course. So like you mentioned, we are located in Brantford, Ontario, downtown, and we offer a variety of different programs and services. So we have primary care. So a lot of our clients will see either a doctor or an NP or nurse practitioner for family medicine, but we also offer counseling for registered patients. We also, and our registered dietitian does nutrition counseling as well as a bunch of other groups and programs which are neat. So we have cooking programs, social groups like knitting and painting. We offer a men's group here as well. And then we also have some psychoeducational groups. And then we have a lot of partnerships as well. So a lot of services are offered on site here, but provided through different organizations. One example is the Diabetes Center. So that is provided through our local hospital, but they come here just to give another space for our community members to come access services. But yeah, just a variety of different programs as well. I might be missing some, but yeah.
That's okay. I mean, it definitely sounds like the typical community health center wraparound approach, and those sounded really nice. I'm always interested in the knitting ones and the fun social ones that CHCs get to do. I'm curious, of course. So, as this podcast episode is about the SNAP project that you were able to do with the funding, and I believe at this point now, quite a few of them have wrapped up, unless they were able to be sustained. But I am curious what you were able to achieve so far with your SNAP project and what impact the project is having, and also what the project is.
Yeah, absolutely. So our project, the duration was October 2023, and it did end in July of 2024 this year. So at the center, which I forgot to mention earlier, that we offer system navigation support. So that is through our community support facilitator, but through because of capacity and whatnot, that was originally appointment based. So I think one of the goals for the SNAP project was to try to accommodate folks without scheduled appointments. So creating more avenues for people to get support and a better understanding of the services that are in their communities. So with the project, we hired part-time service navigators, and I think it equals to about 2 days a week. And then we were able to start a drop-in. So it was offered twice a week during certain hours. Anyone can come as they are with any questions that they have. So they didn't need appointment. And then Bailey as well, one of our service navigators, she also went out into the community where folks were at to meet them there. So yeah, different ways to engage folks. We wanted to try to expand our reach. And so, yeah, we're really fortunate for the SNAP grant in order to allow us to do that. So,
Bailey, I wanted to let you add anything if you'd like, and of course, other things if you want to mention anything that's been achieved or any like direct impact that you've noticed.
I really think it was important that we did an outreach component, which I sort of took the lead on. So I was going into shelter programs and doing a lot of birth certificates and service navigation just to help offset like what the shelter workers were doing and provide additional services. I also paired with another pilot project run by the city of Brantford, and I was going to motels where people who were unhoused had been like placed as sort of like transitional, as part of a transitional housing plan. And I was doing birth certificates to help them further their housing applications. So I think that was a really successful component of our program that otherwise was a bit of a struggle.
Absolutely. I feel like this question, I put it in here even though it's a little bit redundant because it seems obvious to me why these tools are so important and why having, a service navigator, outreach worker, be able to connect all of these dots is so important. But I wanted to give an opportunity for either of you to also flesh out why it's so important for your clients to have this as an option.
Yeah, so I guess since the project concluded, I could say that like during our program, we were able to connect with 320 individuals, which I'm really happy with the number given that this was a part-time initiative, 2 days a week. And so I think it's really important because I think a lot of the folks that Bailey and the other navigators connected and saw, a lot of them may have fell through the cracks within our systems and whatnot that exist. So I think it was just meaningful to them to be able to get some individualized support as well. The opportunity to kind of share their story, their circumstances, and then Bailey was able to kind of see like which services and programs might be appropriate based on their specific needs. And yeah, I think it could be really challenging if you're going through different like struggles and hardships to be able to access that support. It can be overwhelming as well. I think as our healthcare and social services become more and more complex, it's really hard for people to kind of navigate and kind of know which direction to go. So I think having that extra hand and being able to have someone to work alongside them was just a huge benefit for the marginalized folks that we were working with.
I feel like our systems are built with language that's not meant to necessarily be accessible. So to have the ability to build relationships with people and basically act as like a translator. So enable, and like a lot of clients like commented afterwards that the things we were doing weren't so hard. They didn't know where to start. So for me to be able to like build those therapeutic relationships and just like kind of disperse the knowledge, and then as in like any service, I think like word of mouth really is one of the most like important ways to market things. And clients did talk to other clients, and that's how I think we got like a fair amount of numbers.
That's wonderful. It's something that's resonated a lot for the other projects as well in terms of a lot of people don't know where to start. The system's so difficult to navigate. And I've always highlighted that it's hard to navigate when you also don't have a lot of struggles or barriers as well. So when you add all that on, it does become so difficult. So again, kudos for doing this project and doing such great work. I'm curious if there were any challenges that you experienced when you were trying to implement the navigation tools and doing any of the outreach, and how those were addressed, as well as any additional successes you want to tack on.
Do you want me to go first?
Do you want to talk about the tools?
Yeah, so I think because the drop-in model was new in this particular scope, like systems navigation, so getting the word out there to make sure that folks were aware. But I think also while there are benefits to a drop-in model, it can be challenging in the sense that when someone comes in, we never know if we're going to see them again. So it could be challenging if there's no lack of follow-up, and then also ensuring that they have the information and the tools that they need when we first meet with them, that they're able to kind of move forward with that in case for whichever reason that maybe they don't return. So I think that can, like, there's that uncertainty there, knowing whether or not they were supported fully. But yeah, and I guess for successes, I think this project really gave us the opportunity to sort of strengthen as well as build new partnerships. So like Bailey said, we were able to collaborate with the city of Brantford on their pilot project as well. And then also I got the chance to leverage other committees and partners that I was on. So I was leaning on this one committee that I was already previously on. So it's like the Human Services Justice Coordinating Committee. So they were able to provide support as well, especially with birth certificates, as there's like a funding for that as well. And then a few other things. I don't know if you want to add anything at all, Bailey, or not.
I was gonna say, I think like one of the biggest successes of the program is we completed over 40 birth certificate applications, which does help clients again move forward with like getting ID, like further ID, starting their housing, getting a bank account, just all these things that we take for granted that clients really struggle to get the startup for. And I believe we like completed and delivered. I know it was like 20 plus. I don't have the exact number in front of me. But now that like the word is in the community that this is something that's happening, it's actually translating really well into my new role, and people are still reaching out to have these like birth certificates like assistance. We do offer an ID clinic here as well, but with like some of the funding, it does help our more marginalized clients and community members. Yeah, I think just building connections has been really important with different agencies, but also with the community and clients.
Yeah, and I appreciate you, Bailey, for bringing up the birth certificate. So I guess to provide like more context, we are part of a provincial program here in Ontario that allows us to help folks who are experiencing homelessness or are precariously housed. So if they need their birth certificate, like Bailey mentioned, which is like the starting point, like folks need their birth certificate to get their health card, to get their photo ID, even to get employment or even to go to the food bank. So, but there's always that $35 fee, which is a financial barrier for many of the folks that we were working with. So through this program that Bailey and I are part of, we were able to waive that fee, which was a great starting point. And I think, yeah, the word definitely got around. And I guess to add to success for that is with the feedback that received from clients, we ended up applying for additional funding because we are hoping to start an ID bank. So something that we noticed in our community is that a lot of folks were misplacing their documents. And so there was a lot of burden with reapplication and of course, the expense that comes with it as well. So we're hoping that this will not only alleviate our service navigators, but even our partner agencies who are also supporting people with getting documentation. So yeah, I think this feedback and like this program itself really helped guide us and how we are moving forward with applying for future funding. And so yeah, I think we're excited about that too. So that definitely informed our grant application for that.
Wonderful. That's so great to hear. And I know that you've mentioned that, like the project ended at the end of July, but also considering that people are still, doing outreach, and trying to participate with some of the things, would you say that there's been certain elements that have been sustained like in different capacities, or we're waiting for this like additional funding to see what else can be explored in the future?
Yeah. Do you want me to take that on or do you?
I'll just start like from my perspective as someone who is doing the service navigation. So I was actually working two roles within the health center, and it was splitting my time between SNAP and then my other role, which had more hours, was a little bit of a struggle sometimes, though there was overlap in the clientele between the two programs, which was helpful because I could kind of see them in either or. But now that I've like transitioned into a new role as a full-time service navigator and outreach worker, I'm wrapping up my previous role and starting this one. So I do have more time to devote. So like a lot of the foundation Lisa and I set up through this program is now being carried on through my new role.
Yeah. So we're so excited that our CHC received funding from the ministry here through the interprofessional primary care team. So that is the new role that Bailey has taken on. And yeah, we're just so happy that our ED and the staff here kind of see the importance of this and are moving forward with carrying this out. And yeah, I definitely think that SNAP set the foundation for this, and it kind of gave us a better idea of like what's working, maybe other areas that maybe we could explore as well. But yeah, and then hopefully this new ID component bank will also complement this as well.
I have been asking clients I dealt with during like the SNAP project about the ID bank. A lot of them are really excited because they feel like a lot of their setbacks is the constant application for a birth certificate. And if you apply for a birth certificate too many times, we found out during this process, like you can be marked as applying for like fraudulent birth certificate. So a client who's losing a birth certificate every other month probably has some sort of flag on their account now. So I'm able to sort of leverage my position into explaining circumstances, but we're hoping that like the ID bank will mitigate these circumstances as well. I have floated the idea to community partners, and they're also very excited because it makes their job easier
Of course. No, I think that that's ingenious. I think that that's a wonderful idea. And as much as I'm happy that SNAP was a part of it, I'm happy that you're able to, continue on. And congratulations, Bailey, on the new role as well. Excited to see what Grand River continues to do over in Brantford. So Lisa, I'll ask you our second last question, which is what would increased federal or provincial investment allow your community health center to achieve? And that can be related to the SNAP project, or it can be just in general. How would any increased funding help your community health center, deal with your clients and your community?
Yeah, I think with increased funding, it would allow us to continue doing the work that we're doing. And then with more funding, if we were able to hire more staff, I feel like that human resource component is so important. So if we had more staff, maybe we could connect and reach more folks as well. And then, and also work with the folks who maybe don't have a family doctor or not, and let them know about the services that are available, because you don't know what you don't know. So if we had more people on the ground to let people know what they could be eligible for, like, it can make a world of a difference. So yeah, just to answer your question, allow us to continue the work that we're doing and furthering what it is that we're doing. So yeah.
Absolutely. Bailey, if you wanted to add anything, I'll throw it to you.
No, I think Lisa pretty much covered.
Most people say that we just want to be able to do the work. We just want funding so that we can impact people and do the work. Um, uh, Bailey and Lisa, this is a wonderful conversation. Thank you both so much for taking the time to speak with us and for doing the SNAP project. I'm sure so many people were impacted, and I'm happy to hear you're still getting that outreach and doing more. And honestly, I've heard so many people listen to these episodes and find other innovations as well. So I encourage anyone who's listening to reach out. And also, if you want to listen to other episodes, there's been a lot of, good cross community bridge building because of the SNAP project, which has been wonderful. But on that note, if anyone did want to learn more about Grand River Community Health Center, either about the SNAP project or anything in general about your CHC, where online should they be looking?
We do have a Facebook page, which I believe has our most following. So if you'd like to be a follower, we have a Facebook page as well as an Instagram. Grand River CHC are our handles, and then we also have a website as well. So and then yeah, on our website there's a bunch of different information, especially about when we started, the partners or the partnerships that we have, about the different programs that are being offered. We also have an event calendar so folks can see when our groups are being offered if they like to join, and more information on registration and everything like that can be found on our website as well.
Perfect. So I'll have that on the screen so people can look into it. And again, thank you both so much. This was such a wonderful conversation, and I look forward to seeing more about what Grand River gets up to in the future.
Thank you.
Thank you.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.